Here we go. Recording started. Welcome all to this evening's lecture. My name is Stefan Hartmann, Iron Direct Primary Care. I'm bringing you all a lecture tonight on what to do for the congested patient. In particular, we're going to talk about N-acetylcysteine nebulization for mucolysis. And let's get to screen sharing here. Excellent. You all can most likely see my screen now. So why NAC? Patients will come to the urgent care and ER millions of times across the US and around the world for congestion and cough, sinusitis. These are very common conditions. And invariably, they'll get an antibiotic when they leave. And it's not just an American thing. This is actually a big problem. In particular, Egypt, of all places, they seem to prescribe a lot of antibiotics for common colds. And it's predominates a common American culture as well. Patients think that azithromycin, doxycycline, these powerful antibiotics, that they will help their cold, or perhaps that maybe they need an antibiotic for their cold. And invariably, they'll get an antibiotic when they leave, because when patients go to an urgent care, the urgent care wants to please the patient and they want a return customer. And if the patient feels like they get treated at the urgent care, they'll go back. And that's how the urgent cares make money. And I worked for these urgent cares and I know how it works. And that's what they tell you to do, is give them antibiotics. They'll come back because they feel like they're treated. But I wouldn't do that. I would try other things back then. I would do Tesselon Perles. This is benzonatate. It's a cough suppressant. It works sometimes. Then there's Guaifenacin. This is an over-the-counter expectorant. It works a little bit. And then there's phenylephrine and pseudophed. Now, pseudophed is not, well, it is over the counter, but it's behind the counter. You have to ask the pharmacist, and you have to give your license, and you have to sign something. The reason is because you can use a lot of this to make methamphetamines. This was popularized in the show Breaking Bad. They went into various pharmacies and they bought up all the the pseudophed to make meth out of it. Now you can use it like that, but it's also powerful vasoconstrictor. So it's a little bit dangerous for hypertensives, and kids shouldn't use it so much either. And then there's phenylephrine. I don't think that one works at all. So patients sometimes think that the Z-Pak and the doxycycline works, and it's because these things are anti-inflammatory. So specifically the bronchitic patients, those chronic smokers, they'll feel like they got a good deal getting a doxycycline, and they say, it's the only thing that helps me, doc. Please give it to me. But let's talk about an alternative here, N-acetylcysteine. You may have heard about this. The FDA tried to limit its over-the-counter accessibility during the pandemic for unknown reasons. It's because it's a natural product and it works. It's an antioxidant. It's the precursor of glutathione. Glutathione is the body's master antioxidant. So you can supplement with cysteine and glycine. These are the precursors of glutathione to maximize the body's stores of glutathione. Glutathione, it declines with age, and it declines and it's used up in diseases, diabetes, high oxidative stress. It's used up by drinking alcohol too. Alcohol burns through glutathione. Your liver makes it, and if your liver isn't in hot shape, you likely have low glutathione. So glutathione acts on several enzymatic systems of the body that help eliminate free radicals and detoxify fat-soluble components. It also exerts a metabolic role in various biochemical processes, including amino acid transport, DNA synthesis, and immune system improvement. In the epithelial lining of the lower respiratory tract, glutathione is the first line of defense against oxidative stress. The concentrations in the lung are 140 times higher than in the serum. The lung is actually a fantastic sponge to absorb medications and nutrients. Some people don't think you only have to take things orally to get it into the system. The lung is actually a much better sponge for absorbing medications and nutrients. And some medications and nutrients work very well, in particular glutathione or NAC, when they are nebulized into the lung. N-acetylcysteine can also work very well in COVID-19. And these patients, they'll be depleted in glutathione, and they'll have greater glutathione demand for N-acetylcysteine and glutathione. When I was researching how to treat COVID in the pandemic, because I called the CDC early on and I asked them, what do we have to treat COVID patients? This is back early 2020. They said nothing. They said, give them Tylenol, send them home. And I didn't take that for an answer. And I went and researched what other people in the world were doing. In Russia, they were doing IV glutathione. And that was actually the first time I came across glutathione, and I learned about that. And I started applying that early on in the pandemic, and I was suggesting for patients to take glutathione. NAC has been used for a long time as a mucolytic, and it's been proposed by the American Thoracic Society and the European Respiratory Society, but it really hasn't hit mainstream yet. N-acetylcysteine plus bronchodilator for the treatment of chronic bronchitis. Chronic bronchitis, a lot of people have it, in particular smokers. Some individuals, maybe they're exposed to mold or mycotoxins, some environmental toxins, or maybe they're drinking pasteurized milk, and pasteurized milk doesn't digest very well, thickens mucus secretions. This is well known even in conventional medicine. You go to the pediatrician, and some smart pediatricians will say, well, get the kid off of milk. What they should be saying is get the kid off pasteurized milk, but that's another story. It does thicken mucus, the milk. So, but N-acetylcysteine plus a bronchodilator. So these are things like albuterol or racemic epinephrine, as we'll see a little bit later. These two in combination are very good at treating chronic bronchitis. Of note, though, I've been using nebulized saline for some time because I couldn't find N-acetylcysteine in pharmacies, but you can get saline for nebulization. However, this study is showing that it actually could worsen and thicken sputum. So that's making me second guess the role of nebulized saline. I think it matters how concentrated saline is. So if you can get 7% sodium chloride, you can prescribe that actually for nebulization. You can put it nebulized. I've had some good effects with that, but I found that N-acetylcysteine is way better. So the bronchial obstruction previously observed that N-acetylcysteine alone did not occur when the drug was nebulized with racemic epinephrine. So this is really cool. Racemic epinephrine is used in the ER for croupy kids. Croupy kid, you know the sound. They sound like a seal barking. You'll know it when you hear it. They give them racemic epinephrine in the ER, and these kids, that's how you treat it. But I think they should also add on N-acetylcysteine, and I think the two could be very good for these severe bronchitises. Here's a little bit of information about using NAC for nebulization in COVID-19. So COVID-19, it's a high oxidative stress condition. And these patients that suffer more with COVID-19, I've read in the literature and I theorize that they have at baseline low antioxidant status. So this is potentially why they suffer worse with COVID-19. They have worse inflammatory reactions to the disease. It's their own body's own response to the disease that causes the damage. The low glutathione equals more disease. The epithelial lining of the lower respiratory tract, glutathione is the first line of defense against oxidative stress. Again, the concentrations in the lung are a lot higher than in other places found in the body, in particular the blood. Now, I can actually measure glutathione in the blood. I found I could do that at LabCorp for about $50. You can measure glutathione in the blood, but we have no way of really measuring it in the lung easily, unless you're a pulmonologist who can get into the lung there. So the treatment of pulmonary diseases and respiratory-related conditions with inhaled glutathione. Here's a demonstration, or an illustration, I should say, of the lungs. Here's these little sacs here. This represents alveoli in the lungs. Here's the mouth. Here's the nasal passage. So you would put the mask over the patient, and the nebulizer would nebulize the liquid. You'd breathe it in through the nose and the mouth. Now, obviously, you can help break up mucus that might be sitting in the sinus passages by breathing it up the nose. And obviously, you're going to get a lot of mucolytic activity by breathing it into the lungs. So are there any side effects or risk with nebulizing NAC or glutathiones? So there is some suggestion that patients with asthma may get a bit of a bronchospasm, but this can be negated if you add on a little bit of a bronchodilator, albuterol, racemic epinephrine. So this is very easy to do. There is a bit of an unpleasant odor when nebulizing N-acetylcysteine. If some of you may have tasted NAC or nebulized it before, it tastes like and smells like sulfur. So not always super pleasant or tasty, I should say. Chronic obstructive pulmonary disease. You may know someone with this. These are patients who maybe have smoked for many years. So these patients will always have thick mucus, and it's because the smoking, the nicotine, it paralyzes cilia. There are these hairs in the lungs, and when the nicotine, it paralyzes them. So what happens is you get a buildup of mucus there, and these patients, they can't get it up, or they're always hacking to try to get it up, and they don't breathe very well because they've all this basically snot and gunk lining their airways and their alveoli. It's not a good condition. So NAC is the most widely investigated drug with antioxidant properties and has been used in both experimental and clinical settings relevant to COPD because it has mucolytic activity. Treatment with NAC caused symptomatic improvement in COPD patients, reflected by decreased sputum viscosity and purulence and improved sputum expectoration. That means coughing it up. In addition, NAC treatment reduced the number of exacerbations and sick leave days in some. NAC treatment also decreased the number of viral infections and airway bacterial colonization in patients with COPD. And I'd say when I worked in the urgent care, most of the patients coming in with complaints, respiratory complaints, were the smokers. And these patients variably had some level of COPD or in some cases emphysema. It was always the smokers. So here's some research in IV NAC in pediatric patients with non-acetaminophen acute liver failure. And I use this to demonstrate the safety of N-acetylcysteine. So these are very sick patients, children with liver failure. Although it didn't really help treat liver failure in these kids, it wasn't harmful, right? Analysis of secondary outcomes revealed that survival at 1 year with their native liver was significantly lower in NAC compared to placebo. So maybe a little bit of a problem there. But again, that's an extreme population. Why didn't it work? Potentially, a couple of hypotheses around this involving inflammatory dysregulation drives liver injury. So although little is known about the intrahepatic immune responses, evidence suggests that systemic inflammatory responses to trauma differ significantly between adults and children. Inflammation is a complex and dynamic process that encompasses both injury, healing, and regeneration through pro-inflammatory and anti-inflammatory responses. A well-regulated inflammatory response is necessary for proper healing and regeneration. Should pro-inflammatory signal that initiate healing and regenerative responses be blunted at a critical time, an imbalance favoring inflammation may develop. Whether NAC, which serves as an antioxidant, can alter the variety of chemokines that could interrupt healing responses is not known. So this is also one theory as to why you potentially shouldn't use N-acetylcysteine and glutathione in cancer, because cancer therapies and a lot of the therapies that we use here in integrative medicine, like super high doses of vitamin C, they're actually pro-oxidant. They actually cause oxidative stress, which kills cancer cells. But so glutathione and lower doses of vitamin C, they're antioxidants, and they may they may cause a blunted effect of the oxidative therapies we use to treat cancer in both conventional and integrative medicine. So what they looked at here was fulminant hepatic failure caused by viral hepatitis A. They were looking at some NAC pre and post liver function testing. So they showed that in developing countries without liver transplantation facilities, there were improvements in LFTs and encephalopathy, which is basically cognitive impairment. So LFTs are liver enzymes. So there was some improvement here in developing countries in children with hepatic failure by using N-acetylcysteine. This is an interesting case about NAC in a child with liver failure related to dengue fever transmitted by mosquitoes. Let's look at some more here. More on liver failure. There's a lot of studies on NAC and liver failure. Let's get to some more. So some problems with giving kids acetylcysteine orally is they're going to puke, right? So I've seen that with patients taking N-acetylcysteine makes their stomach upset. So this is another reason why nebulizing N-acetylcysteine may be better than taking it orally. Makes your stomach upset. So looking at here, some pediatric acute pyelonephritis, which is kidney inflammation, kidney injury. They noticed that nothing really happened by giving them N-acetylcysteine, but at least it didn't hurt. More look at NAC in acute liver failure. It can prolong patient survival with native liver without transplantation and survival after transplantation, but it cannot improve the overall survival. History of NAC for respiratory diseases. It was first introduced in the 1960s as a drug for chronic respiratory illnesses. Common dose 600 milligrams a day as a mucolytic. Higher doses 1200 milligrams to combat severe oxidative stress disorders. Comparing N-acetylcysteine, comparison of efficacy of N-acetylcysteine with salbutamol in acute bronchiolitis. So why nebulize it? NAC cleaves disulfide bonds, converting them to two sulfuryl groups. The action results in the breakup of mucoproteins in the lung mucus, reducing chain lengths and thinning mucus. Mucolytics like NAC have been studied in the treatment of various diseases, cystic fibrosis being one of them, chronic bronchitis, idiopathic pulmonary fibrosis, and critically ill states. So this is looking at the effectiveness of NAC solution in children with acute bronchiolitis. 16% reduction in the mean length of hospital stay among infants hospitalized with viral bronchiolitis. This percentage reduction in hospital stay is low when compared with other studies where hypertonic saline is used. 26% is study with Bryan and 25% seen with Mendelberg. So maybe there is some role for hypertonic saline. It's not completely out the window. I still like using this because it's relatively easy to acquire, and most pharmacies have at least like 3% solution. Let's see. So all patients aged 2 to 24 months with provisional diagnosis of acute viral bronchiolitis were enrolled. Children were assigned to 1 to 2 groups. One group was going to get 20 milligrams of NAC and 3 mLs of 0.9 saline in nebulization form. Group 2 got 2.5 of salbutamol and 3 mLs of saline. And patients in each group received 3 treatments every day, delivered at intervals of 8 hours for 5 days. 100 children were enrolled. And there's some results here in the 2 groups. Oxygen saturation didn't really change too much between the 2 groups here. And let's see, duration of hospitalization, group 1, 31 days. That would be in the group that got N-acetylcysteine. 5 days in the group that got salbutamol. So I'd say here, maybe the salbutamol group did a little bit better. Wait, 23, 27. I wouldn't say that's too big a difference, but maybe combining the 2 would be helpful. Let's see. Here's some illustrations of airway mucus. Here's some more discussion of the type of medicines used, right? You have the expectorants, like your Guaifenacin. However, studies have shown that these are no better than placebo. And a lot of patients will tell me that too, that they just don't work. You got your tetracyclines, which the chronic bronchitis will swear that it's the only thing that helps them. And it does, it might help some. Yeah, the hypertonic saline, you can get that. The 7% is actually very hard to find in pharmacies. You have to order that ahead of time. And they did a study, a saline hypertonic in preschooler study. Inhaled hypertonic saline was shown to improve the lung clearance index, a marker of ventilation homogeneity in children with cystic fibrosis, age 3 to 6 years. So that's pretty cool. Those cystic fibrosis kids. There's actually a new treatment, I believe, on the market for them. I think it's an immunomodulatory treatment. But in the past, N-acetylcysteine was the mainstay of treatment for the cystic fibrosis kids. We've used it a couple times here at Iron DPC. We had a 4-year-old child. He'd been sick for 3 weeks, fever and cough. We gave him a NAC nebulization. No bronchospasm occurred. I saw her in the office. Lungs were clear. A little bit of mucus coming out of her nose, but other than that, it was much better. If fever broke, we didn't need to use antibiotics, so I would consider that a success every time we don't use antibiotics. We had one patient here. They were an asthmatic kid and gave them the NAC. It seems to actually be improving their asthma, which a mainstay of asthma treatment obviously isn't N-acetylcysteine. So that's pretty cool to see. And if you think about what asthma is, it might be just a lack of antioxidants or a lack of nutrients. And that's what N-acetylcysteine is. It's a nutrient. And so giving back this asthmatic kid this antioxidant was enough to rapidly improve his asthma and get him off some medications. Some practical tips on this is to own a nebulizer. I suggest all patients at Iron DPC own a nebulizer. Now, there's actually been something quite concerning that has been brought to my attention recently. This happened actually the other week, where I had a patient who had a lot of congestion and I wanted to get them a nebulizer. I called 8 different pharmacies and they didn't have a nebulizer. And I was like, what? I remember like years ago, I could order a prescription, any pharmacy, they'd have a nebulizer. I called Walgreens, I called Publix, I called Walmart, CVS. No one had a nebulizer. And I said, why not? They said, we just don't carry it anymore. And I talked to one of my colleagues the other day, Dr. Vela, and he thinks it's because nebulizers were so effective in the pandemic when they were used with budesonide to treat COVID. As someone at the top level said, we need to get rid of this because it's so effective for treating COVID. So you can't get nebulizers at the pharmacy so easily anymore. So you could get them on Amazon. I just don't know the quality of those. You can get them at Amex Pharmacy. They're our local pharmacy here. I know they keep it on hand there because it's so important. I can buy it from McKesson. I can order it in and get it. And I can also get N-acetylcysteine that way. N-acetylcysteine is not available at pharmacies. Typically, you need to ask them to order it in. They'll maybe take 2 to 3 weeks sometimes to order in N-acetylcysteine. I know that's how long it takes to me to get it in from my suppliers. So I typically will keep some N-acetylcysteine here on my shelf because it's been so important for patients with congestion. And the point of using N-acetylcysteine is to avoid antibiotics, because patients will think they need an antibiotic because they're coughing and maybe they got fevers and their sinuses are congested. They say, I need an antibiotic. But the literature doesn't support that. And my colleagues know this as well. We were taught to be antibiotic stewards in school. We were saying, don't give them the antibiotic. They don't need it, right? But what else are you supposed to do for the patients? You tell them to go over the counter, you go get this junk from CVS, you take the pill, it doesn't really work, you're still suffering. So you need alternatives for people, give them relief. Here we have N-acetylcysteine, very safe, right? It causes no harm. At the very least, gives you a bit of antioxidants for your lungs, improves your immune system, and at best, it clears your mucus and saves you from having to use an antibiotic. So that's my talk on N-acetylcysteine. We'll open it up to comments here. I know we have this live on Facebook and Zoom here, and we'll take a look and see if there's any comments here. Let's see. No comments on Facebook here. Looks like my video isn't going on Facebook. We'll end this on Facebook at least. Any comments here from the Zoom attendees?
I have a comment, Stefan.
Yes.
Christy Mundy. Okay, so every winter, I want to say January, February, March, both my husband Michael and my son Hal get a cough. Like, I don't know if it's a genetic thing with them. I don't know. It's the same thing. They always get sick in their chest. Now, my son does use albuterol when this happens, and I mean, it helps. We never do antibiotics. I mean, I really couldn't tell you the last time even if we were prescribed, I just don't give it. But is this something like I should get now for Mu to have on hand for the winter, or like wait and then have you address
Yeah.
at winter time if like needed? But they both get like a very chesty kind of cough.
Yeah, no, I wouldn't wait because as I said, it takes 2 to 4 weeks to get this medication in. It's not easily available at commercial pharmacies. So I just ordered in a supply. I'm gonna get some.
Okay.
I recently I did a prescription at like a Walgreens and it took them like 2 weeks to get it in. So you can do it that way too.
Okay.
Plan
Yeah,
ahead.
I mean, it's never usually until winter, but it's like it's almost every winter. Like it's like clockwork. It's every winter. So yeah, if we can get some to have some on hand to have for the winter time, that would be great.
Yeah, let's do that.
Okay, cool. Thanks.
And it's not that expensive. It's like $60 for a vial. And a vial's like 30 mLs. And you would use like 2 to 3 mLs in the nebulizer 2 to 3 times a day for bad mucus.
Okay, cool. Yeah, we would definitely like to get some.
All right. Can you order it online? No, you cannot order it online. Do not do that. You want to get a pharmaceutical grade nebulization. It has to be sterile. You wouldn't want to get something online that's non-sterile and breathe it into your lungs. Yeah, we would want to get it on hand. I would think for most patients, patients they'll wait for the last minute and they'll blow up my phone sick. I try to get to everyone, but if you're sick and you're blowing up my phone and like I'm busy, you're not gonna get treatment immediately. So do plan ahead with things so that you can start treatment quickly. That's what I always recommend. Early treatment works better. That's what we learned in the pandemic. It's not to sit around on COVID until it starts really bad and then you end up in the hospital. You want to start things early so you can get ahead of it. Yeah, I think every family with kids should get it because they're exposed to stuff all the time. Kids are always getting sick in school, cough, congestion. It's a regular occurrence. And then they have to spend time home, sick, congested. I'd say you see something coming on, you start them early with NAC. That's fantastic. So glutathione, I haven't been able to find pharmaceutical grade nebulized glutathione. I know these studies will mention glutathione nebulization. I've looked, I can't find it. I've asked pharmacies, they can't get it. I can't get it from McKesson. So there's actually a certain amount of dead space in a nebulizer. So you actually need to use at least like 2 to 3 mLs. And the dose is the same across the board. It's 20 milligrams per ml in these 30 ml vials of contained these pharmaceutical grade N-acetylcysteine vials. And so what you do is you clean off the rubber stopper, right? It'll look like this rubber stopper with an alcohol swab. You have a needle and a syringe. You plunge it through the rubber stopper. You draw out like 2 to 3 mLs and you squirt it into your nebulizer. And that's what you'll use pretty much for everyone. Like for a kid, if you have like a 6-month-old, they probably won't like it very much because it smells bad. It smells like sulfur. So you may be able to only get them to do it for like a minute or two. But if you can get some in there, that's going to be very helpful for breaking up the mucus at any age. Let's see, any other questions here? Facebook. Let's see any questions on Facebook here. Let me see here. Let me see if we have any questions. Okay. Is there any effects if you have too much of the glutathione? It's a good question. No, it's not like a pharmaceutical where if you have too much, you could have a bad problem. Nutrients, so vitamins, typically, if you have too much of it, you're going to urinate it out. It's going to be in your urine. It's just going to give you really expensive urine. That's all. Any other questions before we end the call? All right, good. Good. Well, we'll keep doing these. I like doing educational seminars like this for everyone. One more question. What about dry cough? Would that work for a dry cough too, like one that lingers? Yeah, that's a good question. I think yes. We saw that in the pandemic from COVID a lot. They would get like the COVID lung and that dry cough that would last sometimes months. And that was caused by oxidative damage in the lung. And if we look at some of the slides again, we can see that the receptors for glutathione, there's 140 times more receptors in the lung for N-acetylcysteine. So I think we could have prevented more. We could have prevented more of this COVID lung, and you could do CAT scans of these patients in the pandemic. You would see these ground glass opacities in the lung. This was damage. This was oxidative stress damage in the lung, and I theorized that if you give them that NAC nebulization early on before that oxidative damage occurs, you can prevent some of that dry cough, which that's likely just damage in the lungs. That's injury. Right? You're coughing because it hurts or something's wrong in the lung. So preventing the oxidative damage from occurring, I think, could prevent the dry cough from happening in the first place. But it's worth a try even if you have the dry cough. Okay, very good. We'll do this again. I'll let you guys know when I have the next one. Watch my newsletters. That's how you communicate with you guys. You don't get my newsletters every weekend, let me know. Comes out every weekend, Saturday or Sunday, I send it out. All right, we'll talk again soon.